In today's video, I'm going to introduce you to 3 medications that can be used to treat anxiety in different ways. The first medication is known as Xanax and has the generic name of Alprazolam. This medication is classified as a benzodiazepine and it works by enhancing GABA, which is a main inhibitory neurotransmitter in the central nervous system. When patients use this medication, they would typically start off with a dose of 0.25 or 0.5 milligrams taken 3 times daily. Patients may then adjust the dose every 3 to 4 days based on the response they have to the medication, and the maximum dose would be 4 milligrams per day, and this would be given in divided doses. We should always try to use the lowest effective dose with Alprazolam. The only contraindication with Xanax, or reason a patient would not be able to use this medication, would be if a patient had acute narrow-angle glaucoma. 3 common side effects with Xanax would be an increase or decrease in appetite, so really just a change in appetite, incoordination, and memory impairment. The second medication is called Buspar and has a generic name of Buspirone. It's not really completely understood how this medication works in treating anxiety, but we do know that this medication has a high affinity for serotonin receptors and a moderate affinity for dopamine receptors. It has no significant affinity for benzodiazepine receptors, and it does not change GABA binding. Initially, patients would use 7.5 milligrams twice daily. They would then increase the dose by 5 milligrams per day every 2 to 3 days until they reach the usual maintenance dose of 20 to 30 milligrams per day given in divided doses. And the maximum dose for anxiety would be 60 milligrams per day, again in divided doses. There aren't really any contraindications to this medication unless the patient had a hypersensitivity to Buspirone, of course. And 3 common side effects would be dizziness, nausea, and somnolence. And the third medication is called Paxil and has the generic name of Paroxetine. This medication works by increasing serotonergic activity in the central nervous system by preventing the reuptake of serotonin into neurons. It also does have some effect on dopamine and norepinephrine, but to a much lesser degree than it does serotonin. When patients start off this medication, they would typically use 20 milligrams once daily in the morning. They would have the option then to increase the dose by 10 milligrams every week. However, when treating anxiety, Paxil is typically used at a 20 milligram per day dose. There's not much evidence to suggest its benefit beyond that dose. All the contraindications with this medication are related to drug interactions and again a hypersensitivity to paroxetine. And 3 common side effects with this medication would be sexual side effects such as reduced libido, headache, or insomnia. That's it for today. Take care.